Hi, Nick Hodgson here, and today I want to talk to you about what I believe was the most important chiropractic research project in our history, but at the same time it was perhaps one of the most overlooked pieces of chiropractic research in our history. And what I'm talking about is the torque release technique research project that happened quite a few years ago now, but still bears a lot of importance for our profession. So one of the critical things in terms of this research project and the outcomes that it delivered was the design process. So in our profession, from within our academic and research ranks and from without, from the medical community, the scientific community, the political community, there's this pressure that we're supposed to produce gold standard research. And yet here we had a paper that was followed all of the criteria of gold standard research, and yet we probably don't give it the credence that it deserves. So the first thing about this research project was it was prospective. It was designed, developed, ready to go to follow patients through a process of time and a process of care. It was randomised. So as the clients came into the project, they were randomly assigned to the appropriate groups. There was no selection bias. It was placebo controlled. So I'm not really aware of any other chiropractic research projects that were able to achieve this. And when you think about some of the biggest criticisms of chiropractic from without our profession, it is that we're just a really good placebo. You know, we have nice offices with pleasant staff, we have pleasant music playing, we're mostly nice people, we touch people, we care for people, we encourage them. So there's this enormous potential that we're not actually doing anything clinically therapeutic is the criticism. So we need placebo-controlled research that removes that factor and measures the actual therapeutic outcome of what we're doing. This was achieved in the TRT project. There was actually 3 arms in this research project. So most comparative studies will have 2 groups. They'll have a control group and then an active treatment group. In the TRT research, there was actually 3 arms. So there was a standard care group, a group of people who were receiving the normal treatment that they would receive in this setting, and then there was the normal care group plus the placebo intervention group, and then there was the normal care group plus the chiropractic group, the torque release group, the adjusting group. So we have ability to really differentiate some very important outcomes. The findings were statistically significant to a very high level of reliability and specificity. So this is vital that we have these kinds of outcomes in our profession, and it's difficult because within our care mode it is actually difficult to measure that on a research basis, on a scientific basis. But with the TRT research, this was achieved. There were gold standard outcomes. So all of the measurements that were being taken were the best possible outcomes that could measure the different components that were being assessed. So what were the outcomes? So it's interesting because when we talk about the population that was being studied in this project, we're talking about people going through an addiction recovery process, a detox, so to speak. So these people would come in with their particular addictions, and then they would go through the step-by-step process of 30 days of getting themselves cleaned up. And so this creates an interesting response, I find, in chiropractors, because I find a lot of chiropractors would automatically say, well, that automatically makes this irrelevant to me. This automatically makes this disinteresting to me because I don't want to deal with addicts. So the first thing you need to realise is that you already have addicts in your practice. You just may not know that they're there, and you may not know that you might be helping them, or you may not be helping them, and you could be. The second thing is that addiction is literally one of the biggest problems in our society. So think about obesity, think about the impacts of cigarette smoking, think about the impacts of alcoholism, think about the impacts of motor vehicle accidents. Nearly all of these things have components of addiction and compulsive disorders at the root of the cause of these problems. And when you understand the scope of addictive and compulsive disorders, and I'm not suggesting that you need to become a specialist in this area and that you're going to have a practice full of, smelly, unlikable people. In fact, you're going to have a practice full of very likable, very intelligent, very loving, very sensitive people when you open up this avenue to your practice. So we have this population, and they were going through this recovery process. And it's very important that you understand that this is a difficult process that are people going through, and the outcomes are not always particularly good. So what were the outcomes in the groups in this study? So the gold standard for addiction recovery is something that's called retention. Does someone stay in the program? And it's well known in the addiction field that if someone stays in a recovery process, then they get good outcomes. If someone drops out of a recovery process, then they're usually going to get bad outcomes. So this is why this is the gold standard, is do people hang around? And in fact, in this particular study, the normal care group that was just getting what they normally get, they're getting group therapy, counselling, nursing station visits, all of these kinds of things that go on in a normal rehab program. Their retention rate was somewhere around 60%. And in our active care group, our retention rate was 100%. So this is vital that you understand the importance and the power of this outcome, that people, when they were getting chiropractic care, were able to engage and involve themselves in the normal recovery process that assisted them to get better outcomes. The next outcome was a Spielberger anxiety test. So questionnaires that people tick the boxes and respond to in terms of how they're feeling, and it measures the severity of their anxiety symptoms. And again, the results were staggering, and pretty much the results that they found in that 30 days was that the reduction in anxiety levels was pretty much equivalent to what would normally take 6 months of normal medical care with someone suffering from severe anxiety. Beck's depression inventory, so the most commonly used research tool in terms of depression, and a powerful clinical tool. Again, the outcomes when these practice members were being adjusted was pretty similar to what it would take the equivalent of 12 months of normal psychotherapy to achieve. Nursing station visits were dramatically reduced in the active care group. So normally if someone's going through rehab and they have nausea or headaches or pain or vomiting or diarrhea or any other range of signs and symptoms, they go to the nursing station to get some relief. So this tells us when they're getting significantly less need to visit the nursing station visits that there's something significant going on in terms of their well-being. So as I said, you might be wondering, how is this relevant to you in practice? Like, you're in this nice, comfortable private practice. You maybe don't want these addicts, so to speak, showing up in your waiting room, regardless of whether or not they're there already, that is. So you might be thinking, well, this research, I can just put that aside and forget about it. But you need to understand the relevance of these kinds of outcomes to you in your own practice. So the first question is, how do you build a practice? How do you grow your practice? And I know there's massive focus, and you can spend hundreds and thousands of dollars on consultants who are going to teach you how to procure more new patients. And there's a massive focus on getting more and more people in through the front door, and that's how you grow your practice. And that's fantastic. But let's be perfectly honest, the easier way, the less costly way, the less time-consuming way to build a practice is to have a practice where people come and where people stay, and they continue to want to use your services without need for convincing and sales and marketing and all of these other variables that you need to put in place to find more and more and more new people to fill this leaky bucket that you have. So when we see research, a project where retention rates are massively improved, we need to listen. We need to think that might be something that I need to integrate into my practice. And this is what a lot of TRT practitioners find, is that life becomes easier because practice members hang around because they're happy, they feel good, they get good results, obviously. So they're going to want to stay in the program. Anxiety, and depression. When you think of the impacts of those two things in your normal patient base, just when you're doing new patient interviews, find out how many of your practice members nowadays are taking some degree of antidepressive medicine. Talk to people about how they are affected by anxiety and panic and worry and depression and stress and all of these things. And it's a massive epidemic in our culture. So if you have a strategy, if you have a technique that is actually improving these outcomes, consciously and subconsciously, then you're going to be getting good results in your practice. And again, that will lead to word-of-mouth referrals, that will lead to retention, that will lead to happy practice members. Nursing station visits. So in the context of private practice, this is your practice members taking their Panadol and their Nurofen and their going off to the doctor to get some more tests and going off and seeing Chinese massage people and people shopping around and doing all sorts of things in search of relief and feeling better. So if your care just naturally tends to diminish those things, then number one, it's going to decrease the costs to the individual, it's going to decrease the costs to the community, and it's also going to improve their health outcomes. So it's very powerful. If you're producing these kind of changes in your practice members, then it's very relevant to having a successful, full practice. The other important thing to really recognise with the talk release technique research is this connection between the mind and the body. And so many of us want to have a wellness practice. So many of us want to have a practice full of people who are healthy and seeking health and actively working themselves towards a state of well-being. So when we have a research study that is non-musculoskeletal, the last thing we need is yet another research project on back pain. So when we start to get fantastic research that's well designed, that's got great outcomes, then we need to really utilise that in our marketing, in our communications, and also in our building up of our own self-esteem, that we see that what we claim is in fact true. So depression, as I said, it's such a massive epidemic in our society right now, and if you're someone who's helping the people on this level, you're going to become a hero in your community. The same with anxiety. The teenagers with their panic attacks and their the eating disorders and all of these kinds of mental health issues that are literally out there in epidemic proportions, and you could be having an impact on these things with your adjustments. So state of well-being is somewhat different to wellness. Wellness is really about the choices you're making, the behaviours that you're doing to try and maintain a state of health. State of well-being is actually the measurement of the outcomes of being healthy. Mental state, emotional state, healthcare behaviours are all an important aspect of having a great state of well-being. So the next thing that I think really is suggested by the TRT research is this concept of disease burden. If you think about wanting to have your services paid for by Medicare, for example, if you're thinking about having chiropractic recognised for the value that it has to the healthcare of the community, then one thing that we need to clearly demonstrate is a reduction in disease burden. And the way to do this by reduced medical procedures and by reduced medical costs. So this is why the nursing station visits data was so important, because when you think about what happens if you can reduce the amount of medication someone's taking, you're reducing costs, you're reducing side effects. If you can reduce the number of medical procedures that someone's having, again you're reducing costs, you're reducing risks of iatrogenesis. And if you're reducing just the general usage of a whole range of other perhaps less effective modalities, then you're making significant changes. And ultimately, if we're going to prove ourselves as being of great value to the community, this is what we need to do, is to demonstrate a reduction in disease burden. And the TRT research kind of, insinuates that this is true. So the next important thing about this research is where it was published. So the reason that I find that many chiropractors have never even read this research, let alone seen it, let alone comprehended it, is because it's published in places that you probably don't normally see. I doubt that any of you are subscribing to any of these journals. So the first place that the outcomes were published was in the Handbook of Abusable Drugs, which is a massive compendium authored by Dr. J. Holder and a researcher called Kenneth Blum, who was the discoverer of the gene for alcoholism, one of the pioneers in the paradigm shift in terms of addiction medicine and mind-body medicine. And in this Handbook of Abusable Drugs, it lists out all of the different social and psychedelic drugs and psychoactive drugs and how they affect you negatively. And in there is a section on the TRT research. And then the paper in the Journal of Psychoactive Drugs, where the outcomes were published. If you're wondering what the Journal of Psychoactive Drugs is, you only have to read the title. So it's normally the place where all of the new mind drugs are published. This particular edition was a paradigm-shifting model in terms of the biogenetic model of the way that addictions work, the way that minds work, the way that compulsive disorders and impulsive disorders work, ADD, ADHD, all of these kinds of things. There was literally a whole edition dedicated to a new way of looking at this. And in there was the chiropractic research, the TRT outcomes. And then Molecular Psychiatry, published by Nature, one of the major psychiatry journals on the planet, again published the outcomes of this research. And then as a result of that, there was, chiropractors had missed it. So in a normal chiropractic magazine, they published the narrative to this research. So it's great to have that in your hands so that you can actually read how the research was designed and the outcomes, and it's a little bit more easier to read. It's definitely not a scientific paper. And then the Discovery Health Channel got a hold of these outcomes and wanted to publish a special, and so there was a documentary made which included the outcomes from the research. So you've probably noticed that usually if there's a documentary on chiropractic on some of these news magazines on the television, then they're normally not quite so positive, and they usually give a slightly negative light on what we do and what we can offer. And so instead we have this really positive media coverage of the outcomes of our research. So the next thing that was very vital in the development of the TRT research was the development of this thing called the Integrator, the adjusting instrument that needed to be used. Obviously one of the problems with the research was the confounding of the hands statistically, and so it was decided that there needed to be an instrument-based adjustment. And when the research design statistician was reviewing all of the current instruments that were available, he basically came to the conclusion that none of them really stood up to the rigours of scientific research. And so J. Holder was forced into a position where he needed to basically design from the ground up a different instrument that could deliver a corrective impulse into the nervous system. So the first thing was that this instrument was patented for the correction of subluxations. That's what it was designed to do. In the whole process of design and to get it approved for the use in the research, obviously it had to be FDA and then subsequently CA and TGA, all of these certifications that that tell us that this is a legitimate medical tool. So one of the key components of the Integrator is it's very high speed. It's a lot faster than most of the other instruments on the market, fires at an incredibly high speed. When you're thinking of instrument adjusting, the critical factor is the force equals mass times acceleration formula. If you're going to replace your manual adjustments that you may have done for so many years, then you need an instrument that can replace the mass with the acceleration. So high speed is critical. So there's recoil built into the integrator. It just doesn't fire and stay. It literally bounces out, so it creates a nice waveform of change in the central nervous system. So the integrator was designed to surpass the specifications of a toggle recoil adjustment. And then there's torque. Whenever you adjust with your hands, you're always using components of 3 dimensions. There's always that left or right torque within your thrust. The integrator is probably the only other way of introducing this 3rd dimension, that you can set it for right and left torque, so improve your corrective vectors. A critical component of the design is this concept of preloading. The reason that most of the other instruments were not acceptable for the purposes of gold standard research was that they were fired by the practitioner, which varies the forces and the vectors dramatically. So with the integrator, it loads, it locks, and then you place it on the spine and it will fire at a predetermined pressure, so that you get the same impulse each and every single time that you're adjusting someone. That's very important for research, but it's actually also important in practice. And then the frequency, the force characteristics of the instrument are basically designed to be a neurological impulse to have an impact on the central nervous system. It's not a hammer to try and move a vertebrae from the left to the right or from the inferior to superior. It's literally an instrument that's designed to put a very specific impulse of energy in through the central nervous system. So the research was powerful, the outcomes were fantastic, but how can this influence you in your own practice if you learn torque release technique? The first thing that's really cool is low force. It's not until you become a low force chiropractor that you really comprehend just how scared a large segment of the community is of chiropractors. Whenever I do a public talk, the first thing I say to people is, okay, what are the words that you think of when you think of chiropractic? And the word is crunch, crack. And then there's usually a few other kind of less than positive comments that come out of the group. And so in order to help people like this to find a chiropractor that's suitable for them, it's fantastic to have a low force option available, that they can come in and they don't have to be scared of the manual adjustment, whether that's right or wrong. That's just a plain fact, is that there's a massive segment of the population that are never going to go to a chiropractor because they're scared that you're going to crunch their bones. It's tonal. It really does work on the neural frequencies of a person. So the most common feedback you'll get from your practice members is how relaxed they feel, how good they feel after an adjustment, how it kind of switches them off and takes away the worries of the day. And this is very powerful in terms of retention, in terms of satisfaction, is people having a really good experience and literally having a very clear awareness of what's happening to them after their adjustments. There are also business benefits to integrating this kind of technique into your practice. So if you're wanting to be a high volume practitioner, and this is completely personal choice as far as I'm concerned, I don't make any judgment on high volume, low volume, medium volume. There's room for all practice kind of models there. But if you are wanting to increase your volume, then torque release technique is definitely the way to go. You can adjust someone in a very short space of time. You can see a lot of patients in a short space of time. You can practice open plan, closed plan, however you like, but you can increase your turnover of patients quite easily and quite simply in your day. very low stress. The assessment, the diagnosis, the analysis that we teach you in talk release technique is so nicely step-by-step structured so that it's very easy to make decisions about where you need to adjust someone and how you need to adjust someone. And it gives you great tools to be able to monitor where your practice members are up to and where they're at on any given day and over a period of adjustments. So practice becomes kind of less stressful. So that you can enjoy your day, you can get to the end of the day with less fatigue, with less stress yourself. The recurring feedback that I get from practitioners who learn talk release technique is that they find that it just makes everything flow so much more easily in their practice through the day with their practice members. And it does give you a unique selling proposition. So, as I said, there is an enormous segment of the population that is scared of the traditional chiropractor. And when you have a new technique, when you have new technology, when you have a new paradigm that you're sharing with people, when you're talking less about bones and talking more about nerves, when you're talking less about orthopedic problems and talking more about wellness, things change quite dramatically in your practice, and you suddenly find you're getting and attracting a different population, a different demographic into your office. So please join us this year at one of our talk release technique training programs. This year we're introducing a new training process that's much simpler for you. It's a 3-part training process. Nowadays you complete the theoretical modules online, so it saves you having to come to a seminar and sit through hours of theoretical training. You can complete all of the theoretical training in the comfort of your own home and complete the assessment tasks. And then you only need to attend a 1-day intensive hands-on workshop to get your skills up to speed to be in practice, instead of needing to go to a whole 2-day program and be away from home for a whole weekend. You can just come and do a 1-day intensive workshop. And then for those who really take on the TRT and want to learn how to integrate it more and more and more into their practice, we offer another 1-day intensive advanced hands-on workshop where we really show you how to really become a tonal chiropractor, how to see bigger changes in people's nervous systems, how to see bigger outcomes in terms of body tension, how to integrate tonal exercises into your practice, so that it gets better and better and better as you learn more and more about the talk release technique for yourself.